Today, as we said, a great partnership between the FIU Jorge M. Perez Metropolitan Center, the FIU Extreme Events Institute, and the Miami Client Alliance. We have a great lineup of speakers to share great information with regards to vulnerable populations. But before we get into all of that, we're going to kick it off with our directors. And first off, then, Dr. Howard Frank with the FIU Jorge M. Perez Metropolitan Center.
Thank you, Eric. Good afternoon, everyone. I'm Howard Frank, director of the Perez Metropolitan Center, a very vital part of the Stephen J. Green School of International and Public Affairs at FIU. Thank you for joining today's webinar, Hurricane Preparedness and Vulnerable Populations, which we're holding in conjunction with our sister branch in the Green School, the Extreme Events Institute. Fostering greater understanding of critical public issues was one of the prime reasons our center was founded in 1997 as an applied social research branch at FIU, dedicated to inform public policy in the region. Since then, we've grown to become South Florida's leading urban think tank. Our work has 4 pillars: economic development and housing policy, performance management, evaluation and survey research, training, and applied economic and demographic research. Decision makers in the public, private, and nonprofit sectors turn to us for thought leadership and policy guidance to improve their organizations and communities. We're evidence-driven and dedicated to enhancing the quality of life in our region. We take great pride in our contribution to FIU's national recognition as an engaged university. With that, I turn the Zoom mic over to my colleague, Dr. Richard Olson, director of the Extreme Events Institute.
Thank you, Howard, and hello, everyone. I also am the director of FIU's not only Extreme Events, but the International Hurricane Research Center, which means that I've been up since 4 o'clock this morning, keeping an eye on what is happening with Hurricane Laura in the Gulf, and I'll circle back to that in a minute. We hear all the time in the media and elsewhere that, especially with COVID-19, we're all in the same boat, that we're all in this together. Full stop. That's not even remotely true. And living in Miami, we know that it's not true. Groups of us live in different boats. Some are better, some are worse, some are so poorly built and maintained that they're really scary to be in. Even in normal times, these boats that we live in are vulnerable. And disaster research has confirmed for years that vulnerability, susceptibility to harm is the formal term, is sharply different by class, by race, by gender, by age. So let's be real here. Exposure to risk is not equal, not even close. We're not in the same boats. We have to think about differential vulnerability. And boy, I don't like seeing an ongoing human experiment. But right now, as we sit here, and I'm waiting for the 2 o'clock advisory from the National Hurricane Center, Cat 3 and maybe Cat 4 Hurricane Laura is approaching the Texas-Louisiana coast. So we're watching in real time a quick onset shock disaster that's occurring within one of COVID-19's hot states. And they want several 100,000 people to evacuate. So as we watch this on one screen, this seminar is incredibly timely on the other screen. So I've never seen a situation in which we're doing a webinar about a topic that is going to be in our faces by midnight tonight. So back to you, Eric, and everybody stay tuned to both screens. Thank you. Over.
Thanks, Rich. Thank you very much. So we're going to get into that latest hurricane briefing, the 2 o'clock advisory from the National Hurricane Center in just a moment. But I do want to recognize that we have a great lineup of speakers, as I mentioned. Dr. Mark MacGowan with the Robert Stempel College of Public Health and Social Work here at FIU. We have Dr. Armen Henderson, Assistant Professor of Medicine at the University of Miami. We have Alana Greer with the Community Justice Project, and Guadalupe de la Cruz with the American Friends Service Committee, and Sherry Capers with the Miami-Dade Fire Rescue Office of Emergency Management. They'll give their brief remarks in just a moment, but first we'll get right to this hurricane briefing. As Rich mentioned, we want to see what is happening now with the storm. And so let's go ahead and show that now. Share screen. Okay. All right, Helen, can you see my satellite loop?
I can see your background.
Okay, how about my screen?
No. If you
Okay.
can share your screen, maybe.
Panelists, okay. All right. There we go. Looks like we have it now.
Yes.
Okay, thank you. So here we go. This is a visible satellite picture now of Hurricane Laura in the Gulf of Mexico. As Dr. Olson mentioned, we've been watching this now intently for the last couple of days into this morning. And unfortunately, the expectations of rapid intensification did occur overnight. And it is a major hurricane with 140-mile-per-hour winds and headed in the general direction of southeast Texas and southwest Louisiana. And looking at the latest from the Hurricane Center in terms of their briefing and their advisory, this was the 2 o'clock advisory. And you could see maximum sustained winds at 140 miles per hour, moving northwest at 16 miles per hour. You see the cone, and it's expected to make landfall as of the 11 o'clock advisory with 145 mile per hour winds. Category 5 starts at 157, so it's definitely going to be a strong Category 4. We'll see. It runs out of time to intensify further. We hope it doesn't, of course, but that's the general direction for landfall then this evening. And from that, I want to just mention a few things. National Hurricane Center many times tells all of us to don't necessarily always just focus on the cone. We need to focus on the hazards that a storm brings. That cone is really only talking about, geographical location of where the highest probabilities of the center might be. And it gets skinnier as it approaches the coastline because probabilities are high with the computer models of a landfall point, but it doesn't mean the storm is getting skinnier or smaller. And that's why when you scroll up, the National Hurricane Center has really been talking to all of us to really focus on the hazards. And that's why they have a variety of graphics that they show in addition to the cone graphic. And in addition to that, this one right here, peak surge. And this is the expectations for storm surge. You could see if that is the location point coming in roughly just east of the Texas-Louisiana state line, the highest storm surge will be to the right of that, 15 to 20 feet. Possibly, and they already have expectations that storm surge could move northbound 20 to 30 miles. Sections of I-10 is low elevation and may even get covered by water in that area, very low-lying area. So that's the thing about these storms is what happens outside of the cone. And there's the expectations for the heavy rain following along generally in the path and then it becomes an inland story. And the Hurricane Center always teaches us inland flooding is a big risk, and they will have that from Texas, Louisiana, up into Arkansas and beyond. Okay, in terms of what's down the pike, well, the good news is you can always go back to the homepage, go to the 5-day outlook, and they just added now the possibility of some development on something, a 20% chance through 5 days here just, east of the Windward Islands. So something else that maybe we'll have to be watching later, obviously, hopefully not. But that's where we can always get that outlook. Okay, and now I'm going to show briefly I have a PowerPoint, and we'll start that. Okay, Helen, can you see the first screen on my PowerPoint?
No, we're seeing the hurricane right now.
Okay. So we will take that away. Okay. There we go. How's that? We got it now?
Yes.
All right, thank you. All right. Just a quick mention, the 24th, just a few days ago, was Hurricane Andrew anniversary. Time flies. It's been 28 years since that landfall here in South Florida, which changed so many things in terms of preparedness. Just want to make that brief mention because that certainly was a historical storm for South Florida. So looking ahead from today, and certainly many of you may have already seen the outlook for this hurricane season. NOAA updated it earlier this month to the possibility of 19 to 25 storms. So if you do the math on that, we have had 13 names so far. So if we do the math, there could be 6 to 12 more names yet that still may be coming later in the next, couple of months, September and October, as we approach the peak of the hurricane season. This was a satellite picture just a few days ago showing Laura and Marco. And this may be a situation that may repeat itself again, where we're going to possibly see multiple storms. And this was the cone of Laura when it was just Tropical Depression 13. You may remember we were in the 5-day cone with the possibility of a hurricane approaching South Florida. So it reminds us these forecasts can change. All of us had to start our plan, but then we were able to kind of turn off our plan, so to speak, but we had to carefully monitor. And this track, notice the track, it's above the islands in the Caribbean. And so therefore, that's why there was the potential for a hurricane in South Florida. But it ended up being that track, a reformation of the eye, and it tracked across all the islands. So it kept it only a tropical storm strength. It kept it south of us, and we were not really dramatically affected, except for the Keys with some tropical storm force conditions. So again, this was Irma's cone, and the point being hazards extend far from the center. So for all of us to understand and realize that with approaching systems, where's the storm surge going to be? Where are the heavy rains? And so on. And of course, in the last couple of years, the National Hurricane Center has been issuing storm surge watches and warnings along the coastlines, really emphasizing the deadly danger of storm surge. Most fatalities from hurricanes come from the water, storm surge or freshwater rainfall flooding. And if a storm should approach our area again, many sources of information to turn to. And obviously one of our best sources is the local National Weather Service office, Miami office, co-located with the National Hurricane Center right on the FIU campus. They will have specific graphics showing what the specific effects would be for a storm that would be affecting us. So it's a great idea to make that as a favorite in terms of a website and knowing where to go for specific information. We all have our plans, and there's different ways you can execute or activate your plans. We have 5-day cones. So one way to look at that is, split up your to-do list in 5 days. And as we continue to stay in the cone, you continue to ramp up your to-do list. And of course, Miami-Dade County Emergency Management, Broward County Emergency Management, Monroe County Emergency Management all have great websites with lots of information. All right, very good. So there's our Hurricane Laura update. And we will now go with our speakers. And with that in mind, we're going to start it off with Dr. Mark MacGowan, the Associate Dean of Academic Affairs with the Robert Stempel College of Public Health and Social Work and Professor, School of Social Work here at Florida International University. And his focus area is mental health. Mark, take it away.
Thanks, Eric. I think it's fitting after that stirring presentation to talk about mental health and our own mental health as a result of what we're facing. I'm part of the Florida 5 Disaster Medical Assistance Team. It's a federal disaster response team. And I'm the mental health person on the medical team. But we just came back from Louisiana. I didn't go, but my colleague on the team did go among the other team members, but it was in Louisiana. And so they were there for COVID relief. So as was mentioned by Dr. Olson, I think that area is going to have a real double dose of both vulnerability because of COVID, but also of this hurricane. So I'm excited to talk about something. These are the questions I'm going to be asking. I also need to warn you all that we have very strict time limits, and I want to try and set the example for time. So I'm going to start my stopwatch. I have a presentation. I may race through it, but I'm happy to send it to anyone. And if you have any questions, we'll cover that in the Q&A. But these are the questions I'm going to address. And Richard actually has opened up the question about who are the vulnerable. And I think this is a salient point. Disasters do not discriminate. People do. And we make conscious decisions about where we put our resources and where we put our support and help. So the CDC defined 5 broad categories of at-risk populations. And these are just some of them. And it depends on the disaster we're talking about, or the mass casualty event, as I would call them, that we'll be looking at and probably talking about over the different speakers. I want to bring that to this model that I have, which relates to before a mass casualty event, during a mass casualty event, and post-mass casualty event. Now, this is a scenario that would look at a hurricane kind of scenario, or a tornado scenario, or one of those predictable events. Some of this has very little bearing on how we're dealing with COVID, but some of it does, and I'll get back to that in a moment. But I just want to highlight that there are some of us who are more vulnerable to the effects, the mental health effects from disasters than others. And some of the points that were just brought out in the previous slide related to sort of mental health vulnerability, economic conditions, physical vulnerability, having supports. All those things in place before a mass casualty event helps to reduce the effects of mental health issues. During the event, of course, there are a number of factors that may help maintain your mental health or deteriorate your mental health. And post-mass casualty event is other factors that carry through all 3 areas, but some things that get aggravated post-mass casualty event. And as an example of this, when we were deployed to the Panhandle for Hurricane Michael, this is the kind of scene we saw. And you've probably seen these pictures. On the one hand, we have total destruction of houses. In other cases, we have houses that are still standing. The question is, what shelters can the vulnerable afford? What shelters can people who can afford these luxury places that are very well protected feel safe? And that's an important question. The other one we talk a lot about in public health is health disparities. And we know from studies that are coming out of the CDC, for example, that there are disparities in incidence of COVID-19 among the underrepresented racial ethnic groups in counties identified as hotspots. This is during a study during June, between February to June. And of course, we're one of those hotspots. It's clear, the evidence is clear also that not only are people vulnerable, some people more vulnerable than others, to the effects of, say, hurricanes and preparation for hurricanes, but it's clear that some of us are more vulnerable. And so getting away from the collective we, there are those in our communities who are much more vulnerable to the effects of COVID-19, which also elevates the likelihood of having issues. And what are the issues? The second question I need to address quickly is pandemic effects on mental well-being in the United States. Now, I have other information on other countries of the world that have been dealing with this perhaps earlier than us, but I just wanted to give the data about the USA. And this is really from one of the studies that was done through the CDC. So emotional distress has been heightened. Anxiety has been heightened. The stress, depression has been heightened. And also the way people are coping with with COVID has also created an issue. So in the same study, about 13% stated having started or increased substance use to cope with stresses or emotions related to COVID-19. So the very big difference between what we're seeing on the screens that was presented at the beginning, we can get in our cars and leave, or take in an airplane and get away from these masses that are coming towards us. Well, we can't do that with a pandemic. So it creates this mass worry among us because we don't know if we're going to get it. So that's creating this emotional distress within the United States and really worldwide, and we're coping with it very differently. So I just want to briefly show you one of the measures that I found that was quickly developed back in February or March on fear of COVID. And it's a 7-item scale. It addressed the level of worry about COVID-19. By the way, I'm going to invite you, if you have your phones, I'm going to ask you to take a picture of the QR codes I'm going to show you, because those are resources you can take away with you. So take a screenshot of what I'm about to show you. This is the brief measure of fear of COVID. And I've been administering it over the last couple months, and I've got a relatively small sample that I've taken, mostly from FIU, some from the community, but all related to sort of discussions I've been having. And I don't have a lot of data here, but I do want to highlight one thing, and that is the very few people who've responded where I've asked for gender have indicated that the females are much more vulnerable than the males in terms of COVID worry. So I do want to highlight, at least for the data, the very limited data, and it's very preliminary, so don't quote this. We're having more worries about COVID in some groups than others. So I have here the scale that if you take a QR, if you take your phone and just put it up and do a snapshot of it, just save it and you can get into it. And that's the picture of me early in the pandemic, being a little more careful about getting COVID than probably is necessary. But anyway, take a picture of that and you'll be able to do a self-assessment. The good thing about the end of that scale is if you're worried, if you feel like you've got a heightened score, I've got some resources that you can follow up with. And if you're at FIU, I've got the CAPS numbers, I've got the EAP numbers. But if you're in the community, there's also resources there for you. The third area, and again, I'm racing through this because I want to be courteous to my colleagues. What are the other impacts of COVID-19 for hurricane preparedness, response, and recovery? Well, I want to go back to that little graphic I showed you, that COVID intensifies the effects that we're having against a potential threat from, say, a hurricane. So if you're having some mental health issues that are heightened, chances are you're going to be much more affected by the event that we're going to face if it's a hurricane. So it's very important to look at some of the things I'm going to cover briefly on it. What are some of the things, the fourth area, what is being done to help reduce the impacts? First of all, we all have to be aware of the real effects of the pandemic. So public awareness campaigns, and also the fact that it's hitting some populations more than others is a very important message. The data is there. The second is reducing perceived discrimination and stigma related to COVID-19. That was a big issue when things were first happening in our communities. It perhaps is persisting. Getting help is important. Promoting assessment screening tools, the one I just showed you is one example. Bringing mental health care to vulnerable groups through remote delivery of services like telehealth. So I'm also a therapist in the community, and I deliver all my services are delivered through telehealth, which is actually giving it more of a reach now. One of the research studies suggested that providing mental health support through 6 months after the release from isolation is important, because when you're in isolation, it can also create some other effects. So that's just some data that just has emerged that suggests you need sort of follow-up in terms of your own mental health care after isolation. The last thing I'll say, which is a little encouraging, but there's been some new remote mental health procedures to reduce worry and distress related to COVID-19. And so, for example, I've been training people on self-care procedure for coronavirus, which was developed in Israel. And there's other variations of early eye movement desensitization and reprocessing therapy, which I'm also trained in delivering, that have been disseminated to try and deal with the distress and worry in our regular population. I'm not talking about clinical populations, though there are therapies for that. What resources are there? Well, I'm glad you asked, because here's another QR code that you can take. If you take a snapshot of this, you're going to get two things. One is a list of disaster mental health resources that I take with me on deployments. So typically, even in Michael, we were able to get some hotspots where people could actually call these national numbers. But it's a very, very useful. I can't promote anything more than that one resource. It's a one-page sheet. Take a picture of this QR code. It'll take you to a Google Drive with that one document. And the second document is a Miami-Dade County Official Hurricane Readiness Guide that probably we all got in the mail, but it's there electronically as well. But please take a picture of this. If you don't take a picture of anything, please take a picture of that one. The next one is, if you're a responder, self-care begins with knowing how you are doing. And this is very important. And so what I have here is a little card I usually give out in person. And I also take this with me on deployments to give it to my colleagues on deployments, but it measures compassion fatigue, compassion satisfaction, and burnout. So we talk about sort of emotional labor, and this is a way of measuring this. And I encourage people to even set up a Google spreadsheet where you measure this over time if you're making a career out of helping people in distress. And that way you'll know if you're doing well and if you're not doing well, when to get help. If you go to that website, if you go to that QR site and you follow along with it, you're going to get resources at the end, piles of resources to manage some ideas about managing your own distress and worry if you're a responder. And the last thing I'd like to give you is I'm continually updating a bibliography for the scholars among us. This is yet another QR code, and the last one I promise that I'll share with you, which is a bibliography about pandemics and mental health. So again, this is a live document that'll be continually updated. If you just take another screenshot of this, you'll have access to it. So I appreciate the time I've been given, and I'm probably slightly over, I am, but I want to end it with that and turn it over to my other colleagues. So let me surrender this and give my colleagues other time. And I'm happy to engage in any Q&A later. Thank you.
All right, great, Mark. Thank you very much. Next up, we have Dr. Armen Henderson, Assistant Professor of Medicine at the University of Miami, founder of the Dade County Street Response, and Director of Health Programs at Dream Defenders. Dr. Henderson's focus area is the homeless populations. Dr. Henderson, take it away.
Hey, thank you for having me. You know, it's good to be here and good to see a coalition of groups working together to solve this this big problem that is right at our doorstep, honestly, at this point. I don't have a presentation, but I was just gonna briefly have some remarks, and I'm hoping to get questions to engage individuals and also see how we can work together in making sure that we have a safe plan for Miami-Dade County's vulnerable population. So firstly, we, and when I say we, as a coalition of organizations that we have, including Miami Climate Alliance, Florida Clinicians for Climate Action, my organization, and others like Alana Greer's Community Justice Project. We work in tandem in what we call the Community Emergency Operations Center. We started during Hurricane Irma, or after Hurricane Irma, where we found that the government had a disparate response. The government and private, public, institutions that were tasked with taking care of these vulnerable populations during crisis. It was a disparate response that we've seen in real time, whether it be delivering water or turning electricity back on. And what we found is that not only is it a problem here that needed to be addressed, and we had to organize ourselves into a faction of individuals that could better provide care to our communities, but it was also something that I found was happening across the world, honestly, where people who were more well-to-do got access to resources first, and therefore other people were left to the wayside and had increased morbidity and mortality, particularly after disasters occurred. So in my work with the Community Operations Center, I basically run the medical operations when individuals can't leave Miami-Dade County for whatever reason. We create these makeshift shelters throughout South Florida, including Broward. And, we provide everything from social services and housing, temporary housing, all the way up to, food and water and medication refills and other medical services under my care. And so, since then, we've been educating community members through little community meetings we've been having about how to prepare, particularly in a vulnerable community for hurricanes. But we've also been educating doctors and other medical professionals about how to approach this conversation with patients during patient encounters, particularly using medical students. And so in our group, the Dade County Street Response, we have medical students from FAU, we have some social workers, pharmacists, medical students from UM. And what we hope to do is to continue to lead this education program and to make sure we bring on actual universities, because the students are involved, but the universities really are not that involved in general. We work before, during, and after a hurricane, and I told you why that happens. But in COVID-19, we kind of had things that were exacerbated. So I normally do not work with homeless populations, but what we found is that this is a similar crisis situation to what we've seen during hurricanes. And so because unsheltered folks were told to shelter in place, and there was no thought out plan from my perspective for these individuals, specifically in Overtown and Liberty City, both in Miami, we basically decided to start a shower site, give out tents to individuals, and also to provide hygiene products to them as well as testing and following up with them as well, and educating them about COVID-19 in general. And so that brings me to what happened at the beginning of June, is what's termed, and I don't know who's credited with terming this, but cascading disasters. With now we have the pandemic and we have hurricane season on top of each other. And so within these cascading disasters, there are some problems, some that persisted before the pandemic, and some that are basically new. Some of those are that there's a subset of individuals who live out in the street who are considered shelter resistant. And I want to preface this by saying that the normal response to individuals living on the street is that if you provide them with things where they are, then it encourages them to continue to live the life they lead and continue to be homeless, and that's completely false. And so I just want to throw that out there, because as I bring up some of the solutions, one of the solutions is actually supplying things where people are. So I'll talk about that when I get there. But basically, there's a large population of people who are experiencing problems with substance abuse. There's a large subset of populations who have mental health problems, and the majority of these individuals happen to be middle-aged Black individuals in Liberty City and Overtown, and downtown Miami, which is where the majority of homeless individuals or unsheltered individuals live in Miami-Dade County. You have extreme aversion to homeless shelters in general. and no trust of the current infrastructure that exists based on the leadership that we've seen over the course of the last 20 or so years. Those with felonies are not allowed to be in certain places, and so they're left out to their vices. And now the new one is COVID-19 and developing some sort of plan around making sure that this vulnerable population doesn't become a hotspot, specifically during hurricane season. And so in the past, some of the things that we've done is quite frankly, we've put these individuals in jail. And now I don't know if Alana's going to talk about this, but one of the things that we have is an actual lawsuit against the jail because they're overcrowded. They're just not equipped to handle large populations of people, specifically during COVID-19. And as we've seen all across the country, jails and prisons, specifically those that are housing people who commit nonviolent felonies and those who are just poor and can't afford bail, have been let out. And this is not something that we've actually done in a large scale within our county, which is something that we should do. The other thing is ICE facilities and the problem with having ICE breathing down your back, specifically through crisis situations, and the trust that ensues with particularly state-run and county-run operations, and the communication between ICE and these organizations leads people to not seek services. Another thing that was brought up to me recently was the fact that we use Baker Act to actually get people off the streets, and that's what we've done in the past, and that's something that should not be used. It compounds trauma, and we hope that we can come up with a better solution. And now it's providing protective equipment to individuals, particularly those who are going to be behind closed doors during hurricane landfall, and potentially after as well. So some solutions that we basically put forth after dealing with individuals over the last couple of months at the shower site that we've had. Our education and planning specifically with this population. They want to learn, they want to know, they want to make sure that they're safe. And if you talk to them like human beings, then they get it, and they want to get themselves off the street and get help, particularly during crisis situations. Expanding hotel options, not just to those who are testing positive for coronavirus, but also as a temporary measure to get individuals, to entice people to get off of the street as well. Having masks guidelines. One of the things that we've been doing recently was giving out thousands of masks, particularly surgical masks and also cloth masks that people can reuse, and educating them on why they're needed, et cetera. Of course, expanded testing for this population, opening sports facilities that use tax-funded money, which is something that Miami-Dade County can do. This is in the aftermath of a hurricane, and also delivering services where people are at, particularly in places where there's no flooding and it's still safe. Individuals want to go back to where they are, and delivering those services to where people are, and not criminalizing those things, as we've seen in the aftermath of the pandemic, where homeless individuals can't be in a certain distance from businesses, which is what we've seen on Miami Beach, and really talking to individuals about policy and things of that nature to protect this population. Because the reality is that if you live in Overtown, if you live in Liberty City, and I'll close with this, if you live if you're part of the homeless population in downtown Miami, it's not just that there are health disparities and they're causing people to be sick, but people are dying literally 15 years less than what individuals are literally walking distance from the area. So people in Overtown live 15 years less than people in Brickell, and so on. And so, just being cognizant of these things, and listening to people who are on the ground. And with that, I'll close. And again, thank you for having me. I look forward to the questions.
Thank you, Armen. Thank you very much. Next up, we have Alana Greer with the Community Justice Project. Alana's focus area will be evictions. Alana, take it away.
Thank you so much. I really appreciate being here, and appreciate us thinking about these cascading disasters, as Dr. Henderson said, in context. So I'm an attorney at Community Justice Project, and we get to work with grassroots organizations across Florida who are organizing around racial justice issues. And because of the experience our communities have gone through during hurricanes, I think as a community, we've been uniquely positioned to understand what was coming with COVID. We know that particularly Black communities, Brown communities, immigrant communities within those groups are already disproportionately at risk of so many negative outcomes without these types of disasters. Folks were barely able to make their rent in many parts of Miami without losing their jobs, without the shutdowns, without the real risk that going to work presents for families and for individuals. And when both hurricanes or a pandemic are layered on top of those structural inequalities, the impact has been and is continuing to be really profound. But one advantage we did have as a community was having a base of grassroots leaders that already had articulated what was needed in these situations. And so because of some of the impact we saw after Hurricane Irma, we saw individuals being evicted before and asked to leave their homes before electricity was turned back on, not because there was damage to their buildings or there was a need to get in, but because they were sitting in rapidly gentrifying communities. And that was a structural problem that had a structural fix to it, right? And so there's been a years-long effort to push for eviction moratoriums and to, as part of our preparedness plans, really think about how are we not just thinking about dealing with an influx of homelessness crises because people are displaced, but really thinking about how do we help this and maintain stability of basic human rights, like a right to have a roof over your head while we're going through these crises. And that is very much something we can plan for and engage in. And so Miami-Dade was actually the first in the country to act and have a small moratorium on March 12th. And we've had added layers of federal and state action since then. And that has helped, but it's certainly not been enough. Since March 12th, since the emergency was declared here in Miami-Dade County, despite the many different protections that were put in place to try to stop evictions from happening, over 2,300 evictions have been filed right here in our county. I'm going to share just a little bit of data put together from some of the census poll surveys that have been taken. Here in Florida, roughly almost 45% of renter households have said that they cannot pay their rent and may be at risk of homelessness. And this, if it weren't for the moratoriums in place as those change, weaken, and expire, this study projects that across the state of Florida, we're going to see 749,000 evictions of different households over the next 4 months. And again, depending on what kind of protections are in place, we may be able to lessen that blow. And what we already knew before the pandemic was that Black households, Latino folks, and the communities that are impacted by structural inequality were already living paycheck to paycheck, were already dramatically more cost burdened. And with COVID-19, we know that they're working in industries that are more likely to be hit by COVID-19 and more likely to be on the front lines and at risk of infection as a result. And so there's some dramatic disparities in who is actually at risk here. In these most recent surveys, we've seen Black and Latino households anywhere between 40 and as high as 58% saying that they have no or slight confidence that they're going to be able to make the rent next month. And this is month over month without the types of solutions we really need and the level of aid we really need to be able to close that rent gap that is growing and growing over the months. And so what is it that communities, what do we need to know right now about what is going on with evictions? On July 29th, the state actually weakened our statewide eviction moratorium. And there is no automatic protections in place anymore. What that means is that courts are beginning to hear evictions cases, and the laws here in the state of Florida are incredibly weak for tenant protections. We have the second weakest in the country. The only one with kind of a worse position for renters actually allows renters to be jailed for not paying rent. I believe that's Arkansas, if I'm not mistaken. And so what does this mean right now? So first, what's really important to know is that regardless of your immigration status, the tenant law protects you regardless of whether you're documented or undocumented. And a landlord is never allowed to evict you without a court order. But we know courts have opened back up. So what does that mean? If you are impacted by COVID-19, if you've lost your job, if you've lost some of your income, or otherwise are unable to pay because of the impact of COVID, you do have a legal defense to non-payment evictions. But it's vital that you respond in writing if you get papers from the court. And Florida law only allows tenants 5 business days to respond and raise those proper defenses to be able to get to a hearing stage, and hopefully the courts will respect these new moratoriums. But this really is going to be a household by household battle, and we're really working with a number of community groups to make sure that people have the resources to do that. There's legal aid resources available here in Miami, Legal Services of Greater Miami, or you can join weekly meetings with the Housing Participatory Defense, which is comprised of a number of different groups, including Catalyst Miami, Miami Workers Center, Miami Tenants Union, and a number of other folks. You can join here. You can sign up to join every Wednesday evening. And if you can't access a lawyer, because unfortunately we know there's not enough attorneys as evictions that are coming through, and there weren't enough before this pandemic, there's a new tool made by folks up in Jacksonville for tenants across the state at FloridaEvictionAnswerBuilder.org. And that website, if folks are unrepresented, it can help walk them through how to raise a proper defense if you are impacted by COVID-19 as well. And if any organization, if you're working with a group of impact tenants, or you have members in your organization, or folks in your community, a church group, whatever it might be, that wants more information on this, we're happy. The really important thing, the message we're trying to get out, is that we need to work together as a community. Folks need to respond in order to stay in place, and we need to work to change the structure of the laws that created this situation to begin with, in order to ensure that people have stable housing and can make it through this crisis and start to build towards a more stable overall community.
All right, Alana, thank you very much. Just a reminder to everyone that's watching the webinar here this afternoon, keep sending your questions. We're seeing them pop up, so we're definitely going to get to Q&A and looking at the chat questions as well. Want to answer as many of questions as we can once we have our presentations by our speakers. So next up, we have Guadalupe de la Cruz with the American Friends Service Committee. Guadalupe, take it away.
Hi, good afternoon, everyone. Again, thank you all for staying tuned and for inviting me to this as well. So I'm Guadalupe. I'm the Farm Worker Program Director for American Friends Service Committee here in Florida, and I'll be speaking to the population that I serve, which is the farm workers, immigrant, and undocumented communities here in South Dade. So I'll be answering just a couple of questions, and of course, like my colleagues on the call, I'm also looking forward to any Q&A at the end of this presentation. So one of the main questions that is constantly asked during this time is like, how has COVID affected farm workers during this time? So we already know that farm workers are a very vulnerable community, very much susceptible to like work exploitation, and harsh working conditions, as well as the increase of climate changes that continue to affect the livelihood and the quality of life of many of the individuals working in the agriculture sector. And mainly now what we're seeing through this pandemic is that there have been both a large-scale loss of jobs during this time, and then there have been such an increment or push or demand for the folks that do have jobs at this point to keep those jobs. So by that we mean like bosses are now forcing more and more work upon the individuals that are working at the moment. And because a lot of the individuals that are in this sector are undocumented or are at times the only source of income in their families, that they're working under those pressures to keep these jobs because they depend on that income for their families and for their own sustainability. We're seeing also an increase of infection of COVID in our agriculture industry, and many of those infections leading to a large amount of deaths in the farm worker communities. We are you know, in Miami-Dade, where at one point we were one of the hottest spots, and within the area that I work with in Homestead, you know, we had become one of the biggest hotspots. And then we also saw that our hospitals were already working at capacity. So there wasn't a lot of medical resources available to this community. We have seen a lack of testing and expansive testing within our Homestead and South Dade, you know, these rural areas. We see a lot of, you know, attention being drawn and a lot of resources within like bigger cities like Miami and some of the bigger towns within Homestead, you know, downtown Homestead, with resources being available, such as COVID testing, but we're seeing a lack of that being provided in the rural parts where a lot of these farm workers are living and working at. We're also seeing, you know, just a lack of PPE being provided to workers from their bosses, and then there not being an accountability on bosses to provide that type of PPE, and not having any support for workers in case they do become sick. So there's no paid time off, and people who are exposed to COVID and have COVID are left with the choice of not having a job, or sometimes working through their sickness because they need the income to provide for their families and provide resources such as food and keep a house over their head as well. And then we're seeing this problematic become super generalized as far as like the workers and how it's affecting. And we're starting to see, like, we aren't seeing or looking at this through a gender perspective as well. We have seen more and more cases of violence against women in the fields and in the workplace. And a lot of women refusing to speak out because they are also in need of this work, and at times are the only providers of their families. We see that, you know, childcare has become a problem during this time, where parents are forced to either leave their children at home or take their children with them to the workplace. And, you know, a lot of these issues that farm workers are dealing with have been already around pre-pandemic, and we're just seeing that this pandemic, you know, continues to make these issues a lot harder to live through and work through. And as it connects to how to, you know, connect to preparing for a hurricane, you know, the resources that are needed for this are not available to many people. Preparing for a hurricane takes a lot of resources that many individuals don't have, especially when people are working at a minimum wage, or sometimes, you know, not even winning the minimum wage an hour. So buying necessities to prepare for water, such as food, becomes very hard for them to do. We're seeing, you know, many migrants and immigrants that are coming from other countries that have never experienced what a natural disaster like a hurricane can be. So there isn't that knowledge of what a hurricane or tropical storms can really do, or what there are. So some individuals would be like their first time going through a hurricane and not knowing what to expect, and not knowing how to properly prepare for these situations. And, you know, taking into account there's a number of barriers that people are facing. You know, we have language barriers, we have literacy barriers, and even transportation barriers as to getting those types of resources that they need for these types of preparations. And then when it comes to individuals, you know, seeking shelter in case there is that order to either evacuate or shelter, many of the shelters, you know, and these, I speak on situations that we've seen in the past, when aren't open for members, and sometimes are demanding of, you know, state identifications for people to be able to go in. And we recognize that a lot of the members and individuals that we work with don't have that type of, you know, documentation because of their lack of status. And we know that oftentimes that, you know, the National Guard is called in to support a lot of the efforts here. So that heavy policing, you know, the heavy militarization that we see in these types of situations or these types of shelters also tends to be a pushback for people to go to the shelters to seek help, because there is already such a negative association with any type of authority in our community. You know, recognizing that Florida for a long time continues to be a very anti-immigrant state, and there are very much, you know, these anti-immigrant laws and policies that are put into place that continue to target and affect this community. So, you know, there's a lot of concerns here that are not often met. You know, when it comes to the shelter, there needs to be more information dispersed in the community, especially within the areas that are very much remote and rural. You know, we need those designated local shelters to be made available for folks, and for folks to know where exactly they're supposed to be going, especially within the county. There needs to be like faster responses for that, and for getting resources to community after a natural disaster. Especially when it comes to getting resources out to these areas, we've seen often that many of these areas do not get the adequate help on time, and a lot of the people are left, you know, without being able to apply for, say, FEMA, because of the lack of, you know, documentation or status that they have here in Florida. And although I do say, and although I'm speaking on behalf of like the community that I serve here in South Dade, like these are issues that are very much seen in other remote rural areas of Florida and of the country. And some resources that have been made available to people are, it has been very much a community response. So a lot of organizations and agencies have been stepping in and doing the job that our county and our state are supposed to be doing that aren't doing. And that's work that, you know, like collaborations that AFSC has with the health department to provide, you know, adequate or expansive testing, which is an initiative that we continue to push, especially, you know, recognizing the many barriers that people are facing. We want to make it as accessible and easy and fast for individuals. So we are going to those populations and those areas that we know that their community is at, to provide, you know, testing, and as well as, you know, collaborations that we've done with the other local organizations and agencies to provide information and training on how to actually prepare for a natural disaster and what to expect and where exactly to receive resources in the community. And definitely, you know, as organizations that work with farm worker, immigrant, and undocumented communities, you know, our demands continue to be the ones that we have been pushing since before the pandemic, and now, you know, continue to highlight them during this pandemic, is that, you know, individuals need more expansive testing. You know, we need adequate housings that are available for folks to quarantine outside of their families, especially if they're not able to in the household. We continue to ask for, you know, more PPE. I think I already said that, but and definitely just pushing our state to be very much intentional with working with these local organizations such as AFSC, you know, and CJP, who happen to be here as well, like that they need to be very much included in the decisions, because we are organizations that are working with these populations and are the ones that recognize all of the issues that individuals are going through at this moment. So yeah, I'll leave it there. And again, just always available here to answer any more questions that may pop up.
Thank you, Guadalupe. Thank you very much. Again, a reminder, everyone that's watching here this afternoon, keep sending us your questions. We'll get to those in just a moment. Next up, we have Sherry Capers. She's an emergency management planner and EOC, her human services branch director with whole community human services with Miami-Dade Fire Rescue and the Miami-Dade Office of Emergency Management. And her focus area, of course, emergency management planning. Sherry, take it away.
You're on mute, Sherry.
Thanks for telling me that. I thought I had it all down pat. This is probably my second or third Zoom meeting, believe it or not. So we at the Office of Emergency Management, we try to work to support coordination for disaster response, recovery, and mitigation issues in general. And we try to do our best to do it countywide. Of course, we're not going to reach every little pocket at every single time. I'm the human services planner for the Office of Emergency Management. And for our office, what that means is my responsibility lies in meeting all of you to kind of figure out what your communities are going through, the ones that you service, because obviously I'm one person, and to get out there and try and find everyone might be a little bit difficult. But the major goal is just to make sure that human gaps are reached, and that not gaps are reached, but that gaps are filled, and that we're able to provide a resource if we can, or make connections if we can, to folks that have a resource and your community that actually needs that. Your community is my community. It's just our community. We don't look at Miami-Dade County and 34 municipalities. We look at Miami-Dade County as a whole. All, someone told me 3 million, but all 2.7, I'm sticking with that for now, million folks that we have there. What's really important for us when it comes to vulnerable populations, which vulnerable populations can be defined by anyone's definition, is to make sure that those that are migrant populations, mental health, which is here as well, homeless areas that have already been addressed here at the by the present speakers, but also those that have low income and are just susceptible, as I think Guadalupe was saying. Some people just cannot prepare. They just don't have the resources to do that. But to try and find and make those connections so that if and when we're asked the question, we can provide that information on how to get to the resources that you need as you prepare for hurricane season and as you deal with what we're all dealing with, which is the COVID-19. The one thing, some of the things that I'd like to make sure that I put out there for all of you who have a clientele is that it's important that when damages occur after a hurricane, your clients are able to know how to actually access some kind of resources, and that they're actually able to know who or how to report their damages. Damages should be reported through 311. If you don't, that's for those who don't have a computer, even if you do. But if you have a computer, you can go on the Miami-Dade County website for OEM, which is miamidade.gov/OEM. It's not the best site to try and navigate. I will tell you that now. It can get a little convoluted, but there are different sections that you can figure out how to go to if you're able to use it, and figure out what your damages look like and report those things. Another thing that, as far as hurricane preparedness and or or COVID-19 for vulnerable populations, is to know that reporting, you might get online with 311, which is the easiest for a lot of folks, especially if they have a problem navigating the the computer system, because not everybody's computer savvy. I am not the best at that computer stuff either. But just hang in there when you're online with 311. That is your go-to for government and for government services. For social services, 211 is still your go-to. They've been around for a while. The other thing that I made sure I wrote down a couple of things, because I know there's a lot of groups on that work with the community. There's another resource that's called crisis cleanup that comes about after a disaster, that they do have a website, and it is crisiscleanup.org. Make sure I write it down right properly. Yep. And it's activated when there's a disaster regardless, and they're able to provide with you, yes, oh, I'm sorry, I'm looking at a question at the same time, sorry. They're able to provide for you a list, not a list, put you in a queue, so to speak, to have, or your clients in a queue per se, for resources that need to be disseminated to them. Or they do mucking, they do shutters, they'll do tree removal and stuff like that. And that's something that a lot of people, our vulnerable population, is not aware of, because they're not paying attention or utilizing some of the things that we would assume other folks are using. So in emergency management, we're pretty clear on that. I'm the human services person, and I'm very, very aware that that is something that is not just out there for folks to take advantage of, because that's not something they would normally know about. They have over 1,800 organizations that come out. They do the work for free. They don't do anything major, but if there's a tree on your house like we had with Irma, they will come out and they will take care of those kind of things. I was gonna say that there's a moratorium on evictions, but I think someone said that. If not, I'll just say it anyway. But for persons in that are maybe in need of, not in need of, for persons that are facing eviction, there's a moratorium. It's been extended until September 1st. We'll see what the governor does after that. Like I said, we're the local emergency management. We're not the state, and we're not, so we can't make a decision on that. Some of the other things that are in place for hurricane season, and it has been since last year or the year before, is the door hanger program. The door hanger program is to make sure, and it's in your 2020 guide, which is online, and some of you should have, all of you probably should have received it in the mail by now. The door hanger program was started a couple of years ago with a small group of folks through Miami-Dade Corps, which is Miami-Dade Communities Organized to Respond in Emergencies, which is a group that works with Miami-Dade Office of Emergency Management, our office, to connect community-based and faith-based organizations with emergency management, so we can separate the gap and make sure that we're working together and that we are trying to make sure that we can reach as far as we can reach. But we need, that has to be a collaborative effort. That has to be a back and forth kind of thing. We need to, we're not going to be able to guess all the information that's out there or what the needs are. We're going to need you guys to also let us know at the same time. But I want to make you aware of that. So the door hanger program is to make sure that you put that, yes, I'm okay, or that red, no, I need help, so that the first responder community that has been trained on this program, the ones who have been, can recognize by sight that, hey, there's something going on in this household. Maybe someone fell, and this is during a disaster time. Maybe they have a roof collapse. Maybe they're having a medical emergency and they're not able to get to the phone. And you can look at more about that during, as you look through the 2020 hurricane guide. And my information will be given to everyone if it's not already out there right now by the end of this particular presentation. The other thing that I wanted to make everyone aware of is that we also work with different nonprofit organizations. We have a local voluntary organizations active in disaster, which is called the Miami-Dade VOAD. And when there are needs out there that we are made aware of, or any of our partner agencies, Red Cross, Salvation Army, you know, the larger ones, maybe even the smaller ones, because Miami-Dade Corps are those particular folks are local. They're your neighborhood churches, your neighborhood community organizations. We utilize those folks to help provide assistance. A need comes in, it may come in through 311, or it may come in through 211. That information is communicated to us, hopefully, we're getting it all. And then, boom, we say, hey, VOAD, this person on this street has this need. It may be that that person is already in a bad place and they can't properly prepare for a hurricane. So they may need to have someone work with them, if possible, to save one extra can a week of food, you know, one extra can of beans, one pack of ramen noodles, or not to be disrespectful, of course, because my kids eat ramen noodles, and so do I, or whatever it is, to kind of figure out how to be prepared as much as possible. There's also our long-term recovery group, which is a group of over 40 organizations that are there for the same things, some of the same things, but at a little bit of a different level. There's a spiritual care group, there's a volunteer group, there's a membership group, there's a food group, there's a rebuilding group. And after Hurricane Irma, utilizing the long-term recovery group, which normally in other counties, not ours, would be activated way after a storm, we try to keep our long-term recovery group in the mix all the time. So we're getting top requests even now from folks who have been affected by Irma that still have roof damage and still have issues. So we're like, okay, let's see where funds can be found, whether we're not advocating, that's the wrong word for a government person to say. I'm using my social work term, I apologize. So whether we're putting a little bit of, you know, hey, we need this kind of thing to the folks that may be able to help us to get money to put a tarp on a roof, to get someone to put that tarp on, or things like that. Those things are still occurring right now after Irma. I mean, Irma has not ended for us. We're still dealing with Irma, and we're dealing with everything else that comes after that, because some of the things are just compiling one or the other. I know I didn't hear anyone speak about any type of, and I may have missed it, but that's just me, rental assistance and programs like that I am aware of when it comes to what the county has. I know that our Community Action and Human Services Department, I cannot speak 100% for them, but I do know that they assist with rental assistance. And I also know that one of our major nonprofits, the United Way, has the Miami Pandemic Assistance Program, where funds have come in for that. And these are things that if we're able to make sure we keep connected, that we can push that information out. And it's what you do with that information once we give it to you. Guadalupe spoke about the migrant population. I'm pretty familiar with some of the folks that are in that population, like the group COFO or We Count or other folks who may have heard my name, saw me a few times, and then were like, okay, I'm not here every single day, so they may have forgotten about me. But when there are needs that are in those communities, those are things that on the county level, we would like to know about. It doesn't matter about someone's immigration status. I mean, it just doesn't matter. I'm speaking only for the Office of Emergency Management. I can't speak for any police or enforcement type of things. But if a service is necessary, a service is necessary. Before this call, which was pretty ironic, I got a call from someone about a woman who's down in the migrant population, whom I don't know her name. Well, I do know her name, but that's neither here or there, who had a need for assistance with food because apparently there seems to be a crisis that's building up down in that community again about the need for food. So this person called me, not the person in Homestead in Fall River City area, but someone else, and said, "Hey, Sherry, you know, this is necessary. I wanted to let you know because if you can, we want to get some kind of system down there, some kind of either food distribution or some kind of whatever needs to be done so that the population that's down there can get what they need." Obviously, they called me, talked to me about it because they knew it wasn't going to be an issue. And that's the kind of, stuff that I want to make sure is out there and that you all are aware of as panelists, as well as community organizations, which I love community organizations. I don't know if they love me because, whatever. I wear two hats. I wear my social worker hat because I am an MSW. So people is my passion. And then my role is to kind of navigate and help navigate through the red tape, which is a really thick tape, to kind of get stuff done. And as things move forward, we've made huge improvements from 10 years ago. I've been working for the Office of Emergency Management for 16 years. And when I first started, it was your traditional, quote unquote, traditional organizations, which are large nonprofits that were partnering to get things done. But slowly but surely, it has changed because I've been able to work with my colleagues, which have been wonderful, believe it or not, and other government organizations to say, let me tell you something. Our regular Red Cross or Salvation Army or Catholic charities, we need to incorporate other people. Centro Campesino, We Count, COFO, people like that, so that when they say something is a crisis in their area, we're able to help them get the information they need, the preparedness information they need, do presentations in those areas, establish new points of distribution in areas where we know that folks will take care of the products that are sitting down there and not, ration it off to the highest bidder. And of course, that doesn't happen, but I'm just making that as a comment. And then, move forward, because the whole community concept is what we're all about, especially me as a human services planner. I wouldn't be doing my due diligence and I wouldn't be staying steady with my mission and my calling if it didn't involve trying to bring services to the folks who really need those services and who have traditionally been left behind. And I have a couple other things, but I'll wait for questions, and because I know we're very close to the end, unfortunately, and we haven't even gotten any questions yet. So I'm going to say the first guy took all my time.
All right, Sherry. Thank you very much. We are going to get to some questions and as best we can. So Helen, I know we've been seeing a lot coming in. So if you're able to kind of get to a few questions at your end, what do you think?
Yeah, we'll get to as many as possible. We have about 8 minutes before we wrap up. This first question, and I know a lot of our panelists, they've been answering questions that have been sent in the Q&A feature. So, for anyone that didn't know that was there, please check in. Maybe you had a question that was already answered. So this first question is for Guadalupe. How can individuals support farm workers in Homestead?
Yeah, so there are a number of opportunities right now for folks to support the farm worker community. I mean, we continue to advocate for their rights in the state of Florida. So there's a lot of advocating part that people can take up in, calling your representatives, helping protect, a lot of the temporary protective protections that are out there now. And if you want to be more hands-on, I definitely would say we have a number of COVID-19 clinics that we have been hosting with the health department and other agencies in Homestead. We are going to be doing our 6th event this Sunday. We're also doing a food distribution. So if you're also available to help us with that food distribution, there's also a link that I put into the chat that folks can register and sign up for the various shifts during that time. And then we are also providing a lot of mutual aid support for farm workers and undocumented workers here in South Florida. So there's also that type of support that people can provide us. There's a direct PayPal link that's for our office here in Florida that people can donate and pass along. But I definitely say that if you're not able and we don't want to risk anyone's livelihood or health during this time, continue to help and advocate for our immigrant and farm worker communities. There are a lot of issues that have been, like I stated, pre-pandemic that have always affected the quality of life for our farm workers and agriculture workers. So that's one way that you can support us. And then if you are able and willing, the clinics are one way to help us. We do mass distributions as well. We've already donated over, I think, close to 5,000 masks. So we continue to do those types of events. And again, just if you're willing and able, there's a link that I've put in the chat box that folks are able to sign up and support that.
Thank you so much for answering. I know we've gotten this question a few times. The session is being recorded. So everyone that signed up today, using the email that you registered with, we will be sending you a recording in the next couple of days of today's discussion, and any PowerPoints that the presenters sent to us, we will also share with everyone, all the attendees. Next question. Dr. Henderson, I know you answered this one, but very quickly, could you explain what shelter resistant is?
Yes, that is a term that has been used by the Homeless Trust of Miami-Dade County. People that they consider shelter resistant are those who either do not want to go to the shelter or who they feel will not go to the shelter if something is happening. But in the work that I've actually done over the last 6 months with the same unsheltered population, what we find is that there are a number of reasons why people don't go into the shelter. Number one, because people don't trust individuals who work in the shelter. They feel that they are dirty in the past, uncleanly, and they've gotten diseases or infections at the shelter. Some people do have serious mental illnesses. Some people have problems with substance abuse, and due to the strict rules within the shelter, they just don't want to go. And so there are a number of reasons why people are considered shelter resistant, and that's a term that I've heard time and time again from individuals at the Homeless Trust.
Thank you. This question is for Ms. Capers. Can community organizations request copies of the guide to distribute in the communities they serve?
Yes, I mean, the guides are the 2020 hurricane guides. So yes, of course they can request it, of course.
Perfect. And this next question.
Ellen, if I can just jump in.
Yes.
It was one of the resources in the first link I gave.
Yes.
So if anyone wants an electronic, it would be there.
Yeah, if everyone can please, make sure you utilize the chat and see all the resources that have been posted. And like I said, we're going to share them with as many or with everyone who registered. Let's see. This next question. And this is for Alana. I know you answered this one as well, but if you can just briefly, what is the Baker Act?
So Baker Act refers to a set of statutes in different places across the country that allow for someone to be involuntarily committed for mental health evaluation, usually because they are said to be a danger to themselves or to the public. But unfortunately, we've seen that abused in a variety of ways in the school system when there was some pressure on over the use of arrests of students in school. What we saw was a decrease in arrests and an increase in Baker Act. And so unfortunately, it's been often used, been relied on as an alternative means when there aren't proper resources that can actually be dedicated to solving the problems at hand. It's something that we've seen systems fall back on. And so we really want to be careful about that as a tool that can harm folks rather than do what it was intended to do and bring people resources that really need it.
Yeah, if I can echo that too. I worked in a CSU for a number of years, and I can, I'm an LCSW, so I can do it. It's not a place where you'd want to have someone who's not appropriate for that setting to be there.
Thank you so
and
much.
I just want to add quickly, because I work in the hospital and I deal with a lot of patients that are Baker Acted, and I have in the past. The police can make a decision about whether or not to bring someone to the hospital if they are if they do consider, or if the police officer does feel like an individual is a threat to themselves, particularly in hurricanes, when individuals do not want to go in shelters, a police officer can make that decision. But it's up to a licensed medical professional, usually someone with some sort of medical background, an MD in my case in the hospital, would have to evaluate that individual and figure out whether or not the person should actually be committed to the psychiatric ward.
Thank you so much. Unfortunately, we are out of time, so I won't be able to get to any other questions today. But like I said, we will be communicating with everyone who registered. We'll be sending you contact information for panelists as well. So if you have questions that you'd like answered, please continue the conversation. I want to thank everyone again, all of our panelists for joining us this morning, and all of the attendees for joining in this important conversation. Have a great day, everyone.
Thank you.
Thank you.
Thank you, everybody.
Be well.
Yes. You too.
Thank you. Stay safe.